Ladies and gentlemen and everyone, welcome to our series on Talking to Doctors that's hosted by Cancer Voices SA in South Australia. My name's Julie McCrossin and I was treated for stage 4 throat cancer, or oropharyngeal cancer it's called, with radiation therapy and chemo in 2013. And the purpose of this series is really to share practical tips about how to achieve the best possible results in our important conversations with doctors during our treatment and during our recovery. And it's a real pleasure to welcome Associate Professor Sandra Turner, who's a radiation oncologist at the Crown Princess Mary Cancer Centre in Westmead in Sydney, and also the founding clinical lead of the Targeting Cancer campaign, which is all about radiation therapy. Welcome, Sandra. Thanks for coming.
Thanks, Julie. My pleasure.
Just in a nutshell, what is the main types of patients that you're working with on a regular basis?
So I particularly look after men who've got a diagnosis of prostate cancer and other genitourinary cancer. So that includes bladder cancer, kidney cancer, testis cancer, and also the other main kind of patients I look after are often younger patients who've got tumours, rare tumours of the soft tissues. So we call those soft tissue sarcomas. And so they're quite a different categories and age and stage of patients. And because I'm a radiation oncologist, what I'm doing is usually talking to them about treatment recommendations, often which include radiation therapy.
Most of the people we're going to talk to in this series are going to be patients or family members. But as it's all about how to have effective, good quality conversations with doctors, we want to include some doctors as well and understand your point of view. So from a doctor's point of view, what are the 2 or 3 challenges you face in having important conversations with patients and family?
Look, the number one problem would have to be time. To give patients and their families and carers the adequate time in often a busy clinic when we have other people that we want to give plenty of time to is just it's a constant balance. That challenge to be able to get to know someone, get to understand them and their family, and often deliver bad news, and often need to inform them of something that they may not have any understanding about, and involve them in complicated decision-making processes, often in a very short period of time. So obviously there's never enough time to do what you'd like to do to very high quality.
First of all, what is your 2 or 3 tips to patients and family who are also grappling with that time issue? What can we do to help you give us the best quality conversation? And then I'd like to hear what your tips would be for young doctors or newer doctors. But let's start with the patient and family.
Well, I think as much as possible, having some information is useful, and in fact, on the doctor's side, providing some information about treatments, for instance, before somebody actually attends the clinic can be useful, and that will allow the patient or their carers to actually prepare some questions that they definitely want the doctor to cover. I think the other thing is to remember that the doctor will need to ask a series of quite specific questions, plus possibly review, examine them and review images. And sometimes that can seem a bit irrelevant to the patient, and it can be quite formal. We call that taking a history. But that can be very important to allow doctors just to do that in their time frame, so that they can quickly gather the information that's required. I think just bringing somebody along with you is very important, either a friend or a carer or a family member, somebody that you feel can, support you and will allow your voice to be heard and be able to advocate for you. And also to be able to record what the doctor's saying, either ask to physically record it with an iPhone or whatever, or to be taking notes that you can refer back to is very useful in making sure you've made the most of the opportunity talking to the doctor, and helps us.
Just on that thing of bringing someone, is it all right to ask to bring more than one person? Why I ask you that is that the person who might be very important for your emotional support, which might often be a partner or a very close friend, may not be the best note taker. And so if they can't do both tasks, maybe you could have someone who took notes and someone who was there more emotionally supportive. Is that okay to ask to bring more than one person into the room?
Absolutely. Now, all of this comes with a big caveat that one of the biggest challenges with COVID has been not being able to have any additional people in the room, which has been absolutely dreadful for patients and for the whole care team. But yes, in normal circumstances, doctors welcome family members and carers and support people. Obviously, if there's a very large family, that can come with, dynamics and differences of opinion, which is not helpful for the patient. And choosing those people to be the most appropriate people to support you is very important, yes.
And in terms of reading material before you come, do you recommend Cancer Council booklets or information specifically, or where should they get the information to help them have good questions for you?
I think there are some more general templates for questions you can ask your doctor on some of the reputable websites, including Cancer Council, Targeting Cancer, which is our radiation oncology one. And they're not necessarily specific to the particular cancer, because obviously everybody's circumstances are going to be different. So those more generalised templates of things that you could ask. In particular, if the doctor or care team are able to recommend some information beforehand. So, for instance, if often appointments are made by nursing staff who will have information, so it's worth saying, look, is there something useful that I could read before I came to talk to the doctor? What I don't recommend, if those resources are not made, reputable resources made available to you, I don't recommend Dr. Google or looking up things which will almost certainly not apply directly to you and possibly be unuseful for you.
For any doctors who may be watching this, your tips to them on how to have the best conversations in that limited time frame?
Even though there is a limited time frame, listening is really important. So hearing what the major concerns are of the person and their family, and trying to understand where this person is coming from. And I think at the first consultation, that's the most important thing, as well as imparting the information that you want to impart. But I'd say to doctors, we know this in theory, but we've got to keep remembering that people that are stressed or hearing bad diagnoses or scared about what they're being told are not going to take that information in. So I think never assume that information is being taken on board. And perhaps most importantly, provide the opportunity to have another consultation. So big decisions, I believe, can rarely be made in a single consultation. Obviously, a cost comes into that. That can be another issue. Luckily, in a public health situation, offering to make another appointment straight away, or for a patient actually asking if they can make another appointment to further discuss things, can be a very useful method for making sure that there is plenty of time to cover people's issues.
Another key challenge that you face as a doctor, and then, your tips on how both the patient and other doctors should deal with it.
Well, I think that comes back to understanding the patient and what their angle is on a particular scenario. I think very often when I'm talking to junior doctors, it's easy for people to get into a bit of a sort of protocolized method of thinking about, this is what the right way to treat this person is, this is what they should have. I think taking the time to really listen to what's important for that person, what their social and psychosocial supports are very important in making decisions jointly with the patient. And that comes back to listening as well, and really trying to understand where that patient's coming from and what's important to them.
Often we're lucky enough to be in multidisciplinary teams. And so, as I understand it, if I was your patient, you would have nurses who could speak to me or other allied health professionals who would speak to me, who may be a source of particular kinds of information. So how do you work out as a patient what are the key questions or bits of information to bring to the doctor as separate from, say, a nurse or a speech pathologist or a dietitian or anyone else that you might be dealing with in your team?
Look, I believe that that's not necessarily the role of the patient to try and sort that out. I believe that one of the roles of the doctor is to work out the information that really is their main responsibility and they need to deliver and they have the expertise, but to ensure that patients are guided towards those other resources that are available to provide them with support and information. And we're not in all situations lucky enough to have those people around that can support patients. But that's actually what I was going to say before in terms of managing time, is often if the doctor advocates for having the appropriate allied staff, for instance, in prostate cancer, that we have a prostate cancer support nurse who will be there at many consultations, and making sure that she's available to continue on the conversation or to bring back things from the patient at another time that's more important for the doctor to address is a very valuable support. And what I do when somebody leaves a consultation with me is I always make sure that, as well as hopefully providing them with some written or electronic resources that they can go back and study, they must have some way of linking back into the system. So either the contact details for the prostate cancer support service or some other person, so that they know how to reach out and get some help, because undoubtedly they'll go home, they'll think of other things, they'll read, and they'll think of 100 things that they forgot to ask the doctor. But to have that open avenue back to the doctor and the whole healthcare team for that information is a vitally important part of the first consultation.
Just before I leave you, Sandra, and thank you so much for these tips, it's incredibly helpful. Just tell us, what is the Targeting Cancer campaign, and what do patients who may be considering radiation therapy or they've been advised to have it, what can patients get from the Targeting Cancer website?
So Targeting Cancer is a campaign to raise awareness of radiation therapy in the community and also amongst health professionals, because there's a lot of unknowns and lack of awareness about this particular effective cancer treatment, which might often be an option, say, to surgery for curative therapy. The website has a lot of useful information written for patients and their carers. It's got videos, it's got some written materials, but aimed at patients. It's got lots of patient stories and practical information about having radiation therapy or a decision about having radiation therapy, as well as, I mentioned before, questions that you can specifically ask your radiation oncology team.
You're working at Westmead Hospital. That's where Crown Princess Mary Cancer Centre is in Western Sydney, and it's a very multicultural community. Tell us how you're handling people for whom English isn't as a first language and still trying to have effective conversations.
Well, this comes back to the time factor as well, Julie, but we do have good interpreter services. Again, a bit more difficult during COVID, and that has to be more on the phone. But we do have good interpreters. We usually try to have an English language interpreter, even if there is a family member that speaks good English, because often the technical medical jargon can be a bit different. but basically it doubles the length of the conversation and can impair the communication a bit. So when you know that you're dealing with an interpreter or a patient that needs help in that way, you really need to allocate more time or be even more certain to require a second consultation. But it doesn't make sense to have important conversations without proper interpreters there. It's just not fair on patients and doctors. Puts them in a very difficult position of obtaining consent and really knowing that the patient's understanding. So,
and I know you work a lot with junior doctors. So, what are your tips to doctors who are learning to use interpreters and manage the time? Golly, that must be hard.
It is difficult, and there is a whole skill set in using an interpreter. And often people slip into the patient talking in English. And so it's something that we actually do try to teach our junior specialists as they're training. You really still have to develop that rapport with the patient. So there's a tendency to talk to the interpreter, and then the interpreter looks at and talks to the patient talks back to the interpreter. You have to work extra hard on still using those visual and body language cues to know that you're connecting with the patient. That's the most important thing. And that the interpreter's voice is really your voice and the patient's voice, but your contract and your communication is still directly between you and the patient.
Yes, you've got to look at the patient even though you're hearing what they're saying from somewhere else.
That's right, and it's a tricky skill. Yeah,
it is. Sandra, thank you so much. It was just fantastic to have you as part of our series on talking to doctors. Thank you very much.
My pleasure. Thanks, Julie.
This is Deaf Sign Clapping.